Welcome back. You're still watching It's a Beautiful Day. This is Weather HQ. As the rainy season starts here in the Philippines, it also marks the rise of dangerous infectious diseases that threaten public health, including dengue, leptospirosis, and various stomach infections. Today, joining us via Zoom is one of the country's top infectious disease specialists, Dr. Rontgene Solante, chair of the Adult Infectious Disease and Tropical Medicine section at San Lazaro Hospital, to help us understand the most common diseases during the wet season and how to identify the early symptoms, as well as what we can do to protect ourselves and our communities. Magandang umaga, Doc Solante. Really appreciate you being here with us on It's a Beautiful Day.
Hi, good morning, and good morning also to our viewers and listeners.
Doc, let's talk about first why when pagdating ng rainy season, pagdating ng tag-ulan, dumadami talaga yung mga infectious diseases, or at least we say that people are sick dahil rainy season nga.
Yes, there are infections that are that will increase in times like rainy season, because these are what we call tropical infections, which means that the environment will play an important role in terms of the carrier of this infection. Like for example, dengue. Why dengue will be much more higher during rainy season? It's because of the ability of this mosquito to populate more, to copulate more, and they are a lot of them during this time of rainy season. They thrive in waters, especially standing waters, and in highly urbanized population like Metro Manila. We always hear that during rainy season there is an outbreak or increase in the number of dengue, because the mosquito carrying that the virus will also be higher in terms of density and number. So that's the risk of exposure of people for dengue will be higher. I think the other one that we have to be watchful is again leptospirosis, because last year we had one of the highest number of leptospirosis over several years now, if compared to the previous typhoons, no. And leptospirosis comes also with a very high mortality, especially among our population, the younger population who are outside working and exposed to this flooded waters.
Doc, when we talk about, I want to focus on dengue first and foremost, because earlier in the year, we were able to actually see a spike in dengue when it was not the rainy season. From a standpoint of a healthcare practitioner po, especially looking at what we saw as a trend of a sudden increase at the start of the year, what are we expecting in terms of yung dengue cases in the rainy season? Do we expect something a bit more, or are we more guarded right now? Kasi sa start of the year, medyo tumaas nga yung number of dengue cases in a time frame that we did not expect it to rise.
Well, if you look at the trend, no, in terms of epidemiologic surveillance and trends of dengue cases, even if we do a lot of these preventive measures advocated by the Department of Health, it's always cannot prevent the increase in the cases, especially during the rainy season, because of our environment, because of a lot of the factors that are being considered there. Dumadami ang ulan, tumataas ang risk ng mga areas na flooded, no? And at the same time, yung mga basura, you'll notice, no, pag umuulan, ang mga basura talaga hindi din makontrol natin. These are things na talagang it's really in the environment, why the rain can be the factor there that ang cases natin, ang dengue, mataas talaga.
When we talk about trends, you mentioned it po. Let's look at it from a year-to-year basis. Has there been any improvement in the way that in the numbers of infectious diseases that San Lazaro Hospital in particular has experienced throughout the years? Has there been any trends in a good or a bad way throughout the recent years in terms of the rainy months?
Well, that's a very good question, no? Because in fact, when we look at trends every year in terms specifically for dengue, no, talagang wala, no, hindi natin nakikita yung nag-improve tayo with regards to control of dengue, and that's why one of the reason that we always advocate that hopefully our country will detach ourselves to just an environmental part of controlling dengue, but also implement or include vaccine, no? Because I think for people who are also highly vulnerable, like children, the elderly population, and even there are we see some healthy people or individual with dengue still die because of the virulence of the dengue virus. I think that's another option that we can have in terms of how we can really control and lower the mortality of dengue.
Leptospirosis, yun na-mention nyo rin po kanina, it is a big concern when it comes to the season. A lot of it is environmentally related. Some people, nakita natin the trend nga kapag bumabaha, may talagang nagsiswimming sa flood and they have fun with it. When you take a look at the symptoms of the people should watch out for, especially yung early symptoms po, how can we identify leptospirosis early on?
Yes, most of this infection, no, hindi lang leptospirosis, even dengue, the most common symptom is fever. Okay, so you have 2 to 3 days of fever. Specifically for leptospirosis, ang tandaan natin, pag halimbawa lumusog ka sa baha, no, after 3 to 5 days of that, you will already have the first symptoms of fever, panakit ng katawan, no, masakit yung paa, and then namumula yung mata, no, we call that conjunctival suffusion. And then yung pinaka-importanteng sintomas that we need to be aware sa mga na exposed sa baha. Pag yung lagnat mo tapos kumukonti na yung ihi mo, that means that your kidney, no, o yung bato mo apektado na rin, no. Means you need to go to the hospital because our experience, a lot of these people or patients, they still go to work kasi ito yung mga workforce na kadalasan ang affected dito, yung mga motorcycle driver na nagde-deliver ng food or whatever is that. That's one of the most common patients that we have, no, yung mga drivers, yung
Yeah.
mga naglalakad sa kalye, nagbebenta ng mga ano-anong binibenta. These really are the vulnerable, no. So kadalasan sa kanila pag may lagnat, okay lang, no, hindi pumupunta sa doktor. Doon na lang sila pumupunta pag wala na silang ihi 2 to 3 days after, and it's so hard to control and treat them because at that point in time apektado na yung bato nila, meron na silang tinatawag na severe renal failure, kailangan na silang ma-dialysis, and sometimes this patient will really not survive long.
Doc, we're running out of time, but then before we let you go, let's try something special here. Let's try to lower yung numbers po ninyo when it comes to dengue cases and leptospirosis cases by giving some advice po of how people should act as we enter the peak of the rainy season, as we are starting to see more and more rains entering the country. What word of advice can you give moving forward to prevent dengue, leptospirosis, and all of the other diseases that do come along with the season?
Okay, so for dengue, no, importante sa dengue, maglinis ng kapaligiran natin. Huwag mag-imbak ng tubig, yung mga tubig na kung saan namumugad yung lamok. Pag merong sintomas sa first, second, or third day of fever, huwag patagalin, pupunta sa doktor para masuri, matest. May mga available test na tayo ngayon sa dengue. For leptospirosis, as much as possible, huwag lumusong sa baha, no, or sa tubig, no. But in the event hindi mo mapigilan yan, if you had that chance to go to the center, there is what we call leptospirosis antibiotic prophylaxis. Iinumin mo yan, bibigay yan sa doktor sa center para hindi mag-develop ng leptospirosis. Pero pag nag-develop ng symptoms na after wading sa baha, please go to the hospital early para meron pa tayong magagawa because these are all treatable, no? So ang point ko lang dito, pag may mga sintomas na huwag patagalin, 3 to 4 days, may lagnat, masakit ang katawan, magpatingin na because a lot of times we can still do something na hindi tayo magiging mamamatay sa mga sakit na ito. Salamat po.
Salamat rin po, Dr. Solante, for sharing your expertise with us, and hopefully we can get those numbers down soon. Maraming salamat po.
Thank you.